So there's new study out of patients with heart disease showing that modern treatments like stents may be overused. Fox News medical correspondent Dr. Mark Siegel joins us now. This could be great news for so many Americans that suffer from heart disease. I mean, can medicine actually take over from these surgical procedures?
Yes, most of the time. And it is great news, and it's very important news, and it backs up what a lot of us have already thought, a lot of physicians have already thought, which is let's practice the art of medicine. A patient comes in, and 17 million people have this problem. They have a blockage in the arteries that feed the heart. What do? What does a doctor do? First thing we do is we give them an aspirin, we treat them with cholesterol-lowering drugs, and we lower their blood pressure. Is that enough? Well, that's the question. And what this study answers is that it's probably as good or better than sending them to the catheterization lab and putting in a stent if they're stable. If they're stable, the risks of death in this study and the risk of a heart attack is not any different whether you put in a stent or a bypass than if you treat with medication. That's what most of us want. We don't, and most patients don't want a procedure unless needed. But Julie, if you're heading to the hospital and you're having a heart attack, you know what will save your life? A cardiac stent, threading in that stent into the artery. So this puts in a different group people who are stable, people who may be having chest pain. It tells cardiologists, try to treat them with medicine alone if possible. Big study.
You touch on some. What patients care about? What do they care about?
Well, they care about being disease-free. They care about staying alive. They care about not having pain. And if somebody tells them to go to a procedure, Bill, they want to know that it's going to make a difference. So here we go back and say, we can now say to the patient, maybe it will make a difference, maybe it won't. It depends on you. Do you have intractable symptoms? Are you at high risk of death? I now have more information to give the patient than I had before. And the information may say, stay with medicine if medicine is working here.
Wow. But this doesn't necessarily eradicate bypass surgery. A lot of the bypass surgery doesn't only happen after a heart attack. It can happen before to prevent a heart attack.
Very good point. And it's already been shown years ago to work if you have if you have heart failure. In cases where you're really in severe shape, bypass surgery or stent is still the way to go.
Thank you, Mark. Nice to see you,
Dr. Siegel, it's great to see you.
Week 2 public hearings, they will be underway